Hello my dear students, I'm glad to see you on our 6th class. The topic of this class is blood circulation disorders. In blood circulation disorders we have 3 groups of disorders. First of them is disorders of blood filling or disorders of blood supply, in which we can find hyperemia and ischemia. Second group is vessels wall permeability derangement. It will be hemorrhages, bleeding and plasmorrhagia. And last group will be associated with rheological properties derangement, in which we find stasis, thrombosis, embolism, sludge-phenomenon and DIC syndrome. Hyperemia. Hyperemia may be arterial or active hyperemia and passive or venous hyperemia. First of all, we should talk about arterial hyperemia. Arterial hyperemia includes local and general form. Example of general form will be erythemia and plethora. In local hyperemia, we may find physiological and pathological type. Physiological type of arterial hyperemia will be associated with work hyperemia and hyperemia associated with emotional reactions. Pathological hyperemia will be angioneurotic type, collateral hyperemia, hyperemia after ischemia, vacate form of hyperemia, inflammatory type, in the presence of arteriovenous shunts. Anatomical manifestation of arterial hyperemia will be associated with reddened skin, mucous membranes of tissues and organs, arterial hypertension, rise of blood temperature. Significance of hyperemia more often has a compensatory adaptive character. There is no structural recognifications of organ. Outcomes is favorable. Venous or passive hyperemia is increasing of blood supply to organ or tissue due to the decrease in the outflow of blood. Blood flow is not changed or reduced. Significance of venous blood leads to the expansion of veins and capillaries, slowing blood flow in them, to the development of hypoxia, which is the main pathogenic factor determining changes in the organs in venous plethora. Classification of it. It may be general and local, and both of them may be acute and chronic. General venous hyperemia is a morphological substrate of the heart failure syndrome. Causes of general venous hyperemia. Common acute venous hyperemia associated with acute heart failure, complicate large focal myocardial infarctions, acute myocarditis, and in other heart diseases. Due to hypoxia an increase in hydrostatic pressure and permeability of capillaries increase dramatically. Plasmorrhagia and edema, stasis in capillaries and multiply the epidesis hemorrhage develop in the stroma of organs. In parenchyma, dystrophic and necrotic changes. Morphological change in organs in acute form of venous hyperemia will be associated with edema and hemorrhages in lungs. Acute pulmonary edema is one of the known causes of death in patients with acute cardiovascular intensity. Kidney dystrophy and necrosis of the epithelium of tubes. In the liver, you may find central-lobar hemorrhages and necrosis. In this slide, you may find picture of edema of lungs. In alveoli, you may find semi-transparent pink masses which will be transudate, which localized in alveoli. Morphologic changes in tissues associated with hyperemia of veins, stasis, edema of stroma, diapedesis of erythrocytes, dystrophy of parenchyma, but this process is reversible, so this process have fireable course. Common chronic venous plethora accuse of chronic cardiovascular insufficiency. It may be associated with heart defects, coronary heart diseases, chronic myocarditis, cardiomyopathy, and other heart diseases, chronic heart diseases. Long maintained in the state of tissue hypoxia leads to not only pneumorrhagia, edema, stasis and hemorrhages, dystrophy and necrosis, but also to atrophy and sclerosis. It's the main morphological manifestation of chronic venous hyperemia. A congestive seal or induration of organs and tissue develops. Morphological change in organs will be associated with increase of size organ are enlarged, and these organs will have solid consistence, and tissue is of a dark red color with cyanotic tint. In hypodermis, in hypodermic cellulose at venous stagnation you may find edema or anasarca. Fluid accumulates in serous cavities. It will be associated with formation of hydrothorax, hydropericardium, ascite, and in other accumulation fluids in cavities of our body. Cyanotic induration develops in skin, kidneys, and spleen. In two organs, chronic venous hyperemia leads to formation special morphological picture. In liver, we can find nutmeg liver. In lungs, we may find brown induration of lungs. In the skin, skin becomes cold. The veins of skin and subcutaneous tissue are dilated, filled with blood. Lymphatic vessels are also enlarged and filled with lymph. Swelling of the dermis and subcutaneous tissue, proliferation of connective tissue in the skin. In the kidneys, they will be enlarged. They have cyanotic color and dense consistency. In the spleen, you may find that spleen is enlarged, dense, of dark cherry color on incision, and no scraping of the pulp. In this slide you may find macroscopical picture of liver in chronic venous hyperemia. It have name nutmeg liver. The liver is enlarged, dense. Its edges are rounded. The cut surface is irrigated gray-yellow with dark red specks and resembles nutmeg. In lungs, macroscopically you may find rustic color or brown color of this organ, and lung will be enlarged and have dense consistency. Microscopically you will find granule of hemosiderin in parenchyma of this organ. In this slide we have Pearl's reaction, so granule of hemosiderin have green-blue color, but in nature colored it will have brown or black color. You should remember it from mixed degeneration. Morphologic change in tissues associated with formation edema, diapedesis of erythrocytes, dystrophy of parenchyma, necrosis, stroma expanding, and organ sclerosis. Chronic venous hyperemia will lead to parenchyma atrophy, stroma sclerosis, and cirrhosis of organ. Local venous hyperemia associated with venous congestion occurs when there is difficulty in venous blood outflow from a specific organ or part of the body due to closure of the vein lumen. Venous compression from the outside, which most often associated with tumors. Collateral venous hyperemia by opening of porta-caval shunts. More often it will be associated with cirrhosis of liver. In case of local venous hyperemia, we see the same anatomical changes as during the common venous plethora, but in single organ. Ischemia or anemia is a decrease in the blood supply to a tissue, organ or part of the body as a result of insufficiency of blood supply. Classification of ischemia. Ischemia may be general and local, and both of them may be acute and chronic. Classification of ischemia according to development mechanism. It may be associated with arterial spasm, closure of the artery through a thrombus or embolus, with artery compression by a tumor, effusion, truncated ligament ligature. As a result of redistribution of the blood, for example, anemia of the brain or during extraction of fluid from the abdominal cavity, the most of the blood rushes. Morphological signs. Organ size is reduction, flabby consistence, paleness, wrinkled capsule. Ischemia outcomes without consequence in case of angiospastic form and short time of angiospasm. Generation and necrosis, infarction in organs in case of acute form if time of spasm will long more than 15 minutes for heart, and for in our organs it will be associated with how long time may organ live without blood supply. Atrophy and sclerosis in case of chronic forms. Bleeding or hemorrhage is the exit of blood from the lumen of blood vessel or heart cavity into environment in case of external bleeding, or in the body cavities in case of internal bleeding. So, as I tell, bleeding may be external and internal. Examples of this form you may see on this slide. Causes of bleeding. First of them is the rupture of the vessel wall with a wound of wall or development of pathological process in it. For example, it may be associated with inflammation, necrosis, aneurysm. Example of this you may see on slide. The second cause is the erosion of the vessel wall. Most often it will be associated with inflammation and malignant tumor. So, area of erosion we may find in ulceration, in inflammatory factors, in tubular pregnancy, in the necrotic zones. And third cause will be increased of permeability of blood vessel, accompanied by red blood cell diapidesis. Diapidesis, hemorrhage, small, pointed, occurs in the microcirculatory vessel, associated with hypertension, systemic vasculitis, infectional like typhus, scarlet fever, sepsis, diseases of hematopoietic organs, DIC syndromes, hypoxic states. Types of hemorrhage. We have 4 types of it. First of them will be hematoma, is accumulation of coagulated blood in the tissue with violation of its integrity and formation of a cavity. Second one will be hemorrhagic socket, hemorrhagic while preselling tissue elements. Third one, hemorrhages planar, hemorrhages in the subcutaneous tissue and muscles. And also it may be petechia, small pointed hemorrhages on skin and mucous membranes. Their size less than 2 millimeters. The outcome of hemorrhage will be formation of rusty cyst, rusty color due to accumulation of hemosiderin. You may find this formation in brain after hemorrhages, in lungs, for example, in skin, and in every places in which we have a long time hemorrhage. Encapsulation or germination of hematoma by connective tissue. Suppuration upon adherence of infection. And this is the most unfavorable course, the last one, the most unfavorable. Consequence of bleeding and hemorrhage depend on hemorrhage speed, volume, and localization. So the most dangerous for patient will be bleeding with high speed, big volume, and if they localized in vital organs for like brain, kidneys, lungs, and adrenal glands. Interstitial fluid content derangement leads to formation of transudate, it's hydropic fluid, edema, fluid accumulation in tissues, dropsy, like fluid accumulation in cavities of our body, and it may be associated with formation of avasarca, hydrothorax, hydrobidocardium, ascites, hydrocephalus. Types of edema. Edema may be local and general. Local type of edema is caused by the local derangement of interstitial fluid metabolism. Most often it may be associated with derangement of blood flow. For example, it may be associated with thrombosis. And general edema caused by retention of natrium ions and water in the organism. So it may be associated with kidney disease, it may be associated with decrease of protein level in blood plasma. Edema may be local and general. Local edema may be associated with allergic or allergical reactions as a result of venous congestive and result of lymph congestions. General edema most often associated with heart failure, hypoprotein in plasma, renal edema, pulmonary edema, brain or cerebral edema, and serous cavities edema. Stasis, a sharp slowdown and stop of blood flow in vessels of the microvascular area, mainly in the capillaries. Cause of stasis, respiratory disorders associated with infection, intoxication, venous plethora, and shock. The mechanism of development of stasis of great importance is the sludge-phenomenon, which characterized by appearance of erythrocytes, leukocytes, or platelets to each other and increase in plasma viscosity. which lead to difficulty in perfusion of blood through the microvascular vessels. Stasis in the capillaries of the brain pose the greatest danger. The capillaries and venules dramatically expand. Overflow with the red blood cells stuck together in the form of coin column. Edema develops in the brain substance. A long-term stasis in the brain lead to a development of focal necrosis. Its clinical manifestation as brain coma. Thrombosis. Thrombosis in intravital blood coagulation in vessel lumen or heart cavities. The blood bundle formed during this process is called a thrombus. Postmortem coagulation have name clots. Thrombosis is one of the most important mechanisms of hemostasis. However, it can use a disturbance to the blood supply to organs and tissues with the development of heart attack. Pathogenesis factor. We may find local and common factors. For local factors is change in the vascular wall, slowing down and disturbance of blood flow. And common factors: imbalance between coagulation and anticoagulation system of the blood and changes in blood quality. You should know that formation of thrombosis associated with Virchow's triada derangement. You should know about Virchow's triada from physiological course. The risk of thrombosis is increased in the following situation: long bed rest after surgery, chronic cardiovascular influenza, atherosclerosis, malignant tumors, pregnancy, congenital or acquired hypercoagulative states. Thrombosis and postmortem clot difference. In autopsy, you should have differentiate between clots and thrombosis, because you may find formation of blood in vascular lumen, and you should know what is it, clot or it's thromb. The clinical thrombus is a dry, friable mass of gray to red color with a rough surface. It's attached to the vessel wall. The postmortem clot is contained as smooth, rubbery and gelatinous, and is not attached to underlying wall. Types of thrombi according to composition. You should know 4 types of thrombus. It will be white thrombs, red thrombs, mixed one, and hyaline. What the most difference between them? The most important, what from they consist. White thrombs consist mainly of platelets, fibrin, and leukocytes. Red thrombs mostly consist from erythrocytes, platelets, and fibrin. Mixed thrombs has 3 parts, like head, tag, and the body of thromb. So the head of this thromb will be white one, the body of this thromb will be mixed thromb, and tag will be red thromb. And hyaline thrombus is a special type of thrombus. It is formed in vessels of microcirculatory rarely. Contains fibrin, consists of destroyed red blood cells, platelets, and precipitate plasma proteins, and it look like hyaline, so we should get their name to like hyaline thrombs. Types of thrombs reading the vessel lumen. It may be obstructive or obturative thrombs, parietal or mural thrombs, and free or ball valve thrombs. Thrombs consequence depends on their lumen localization. Obstructive thrombs lead to acute venous hyperemia, acute ischemia, and infarctions. Parietal thrombs leads to chronic venous hyperemia, prolonged ischemia with development of parenchyma atrophy and organ stroma sclerosis. Outcomes of thrombus may be favorable and unfavorable. Favorable outcomes include aseptic autolysis, the organization of blood clot, and calcification of it. Unfavorable one will be the separation of blood clot with the development of thromboembolism and septic melting of a thrombus. Embolism is a circulation in the blood or lymph of particles not found in normal condition and blockage of vessels by them. The particles themselves are called emboli. So, ways of embolus transport may be different. They may be orthograde, retrograde, and paradoxal one. With the blood flow will be orthograde, against the blood flow retrograde, and from defects of heart or some shunts you may find paradoxal embolism. According of the nature of embols, you may find thromboembolism, gas embolism, air embolism, fat or oil embolism, tissue cellular embolism, and microbial embols, and embolism by foreign bodies. Thromboembolism occurs when a blood clot or part of its turn off. In the most common type of embolism, clinical manifestation may be different. Most often you may find pulmonary artery embolism and thrombosis. Most often this case develops after varicose derangement of venous of lower extremities, and thrombosis of them will lead to thromboembolism of pulmonary artery. This is a very dangerous condition which may often leads to death of patient, because for emergency this patient you have less than 15 minutes, and this patient die from heart stopping. Fat embolism develops when the fats enter to the bloodstream. It may be in case of traumatic damage to bone marrow with the fracture of long tubular bones. Most often it's associated with fracture of extremities. At crushing of subcutaneous fatty tissue, for example, it may be associated with car crushing. In case of erroneous intravenous administration of oil solutions of medical or construct agent, it's associated with the treatment. For example, you should know about special examination with contrast of arteries. So you should get patient oil solution in consist of contrast agent, so it may lead to fatty embolism. So also it may be associated with intravenous admission of vitamins, for example, and in our solution. Air embolism develops when the air intern into bloodstream, then the veins of neck are wounded. After childbirth or abortion, if the sclerosion of lungs is damaged and intravenous air is accidentally injected along with the drug. Air bubbles trapped in the blood cause an embolus of the capillaries of the pulmonary circulation. If air bubbles get into the systemic circulation, brain capillary embolism may develop. At the autopsy, an air embolism is recognized by the release of air from right side of the heart when pairs of them. If you fill the cavity of the heart sheet with the water, the blood in the cavities of the heart was foamy appearance. Gas embolism, characteristic of caisson disease. It develops in the rapid decompression. The bubbles of nitrogen released from high pressure in the soft state cause blockage in the capillaries of the brain and spinal cord, liver, kidneys, and other organs. A characteristic symptom is myalgia. A special tendency to the development of caisson disease is not in obese people, since most of the nitrogen released by fatty tissue. So you should know difference between gas and air embolism. Air embolism most often associated with trauma of vein of neck. Gas embolism associated with dramatically changes of pressure in outside. Tissue embolism. It may occur during tissue destruction due to injury of pathological process leading to internality of pieces of cells or tissue into the bloodstream. Amniotic fluid embolism in particular can be accompanied by the development of disseminative intravascular coagulation syndrome and lead to death of patient. Embolism by malignant tumor cells underlies the metastasis of tumor. In the organs, numerous round tumor nodes often comes to light with depression in the center. Necrosis area. Microbial embolism occurs in case where bacteria circulation in the blood, as well as fungi, animal parasites, and protozoa, occlude the lumen of the capillaries. Often bacterial emboli are formed when a thrombus is purulent melted. Bacterial embolism you may find in sepsis, for example. At the site of the blockage of vessel with bacterial emboli, metastasis abscess are formed. An example of bacterial embolism is embolism purulent nephritic, as often found in septicemia. The kidney is enlarged, multiplied, small yellowish foci are visible of the cortex and medulla. Embolism by foreign bodies. It's observed when caveat, fragment of metal object interned to the blood. Foreign bodies also includes embolism with lime and cholesterol crystals and atherosclerotic plaques. With propagates in the vessel lumen when they are ulcerated. Embolism consequence will be associated with heart failure due to pulmonary embolism, thromboembolism of pulmonary artery, infarctions, tumor dissemination like tissue embolism, generalization of infection for bacterial type, metastatic abscesses, again, aeroembolism or Caisson disease for gas embolism, acute pulmonary failure, heart failure, and another disease. DIC syndrome is a syndrome of disseminant intravascular blood coagulation, which characterized by the disseminated formation of small thrombus in microcirculatory system of all organs, combined with blood incoagulability, leading to multiple massive hemorrhages. This is very dangerous for patient conditions, and most often it's lead to death of patient. It may be associated with infectional disease, neonatal or intrauterine infection, gynecological disorders, liver diseases, malignant tumors, small vessels, vasculitis, major trauma, intravascular hemorrhages, and other conditions. Shock. Shock is a clinical state connected with the degrees of effect, cardiac output, enlargement of microcirculatory system, auto-regulation, and characterized by generalization abundant of tissue blood supply, leading to the structure changes internal organs. Types of shock. It may be hypovolemic shock. The basis is an acute decrease in the volume of circulation blood. Cardiogenic shock, acute to a decrease in cardiac output. Also, it may be septic shock, vascular shock. Vascular shock includes anaphylactic and neurogenic. Neurogenic associated with traumas, and anaphylactic shock associated with hyperimmune reaction. Stages of shock. It's non-progressive early stage. Includes a mechanism that compensates for a decrease in cardiac output to maintain the perfusion of vital organs, brain, lungs, and kidney.